Welcome back. Well, today we are talking about an issue that affects thousands of Kentuckians, lung disease. And in some cases, it can be serious enough to call for transplants. Here today to tell us more about the UK Healthcare Transplant Program, we're pleased to welcome Dr. Don Hayes, a pulmonologist, and also lung transplant surgeon, Dr. Timothy Mullet. Thank you both for being with us today.
Glad to be here.
I guess we'll start with some of the diseases that can lead to transplantation.
Well, actually, Kentucky is a national leader, unfortunately, commonly due to tobacco smoking. But the most common disease we actually transplant here is actually COPD, or chronic obstructive pulmonary disease. Other diseases that also could be considered for transplant are certain types of pulmonary fibrosis. We also do cystic fibrosis. We actually have a fairly large cystic fibrosis center, and so those patients commonly, as they age and their disease progresses, that leads to the need for lung transplant. Then there's other diseases. We actually do a fair amount of co-workers pneumoconiosis, believe it or not. So, but those are the typical. And then, of course, there's other diseases specifically involving the blood vessels of the lung, pulmonary hypertension or pulmonary vascular disease. So those patients may lead to transplant as well.
Well, unfortunately, we don't want to have that high of a rate of a problem here in Kentucky, but the good thing is a long history of this program to be able to give transplants to Kentucky patients, right?
We have. The transplant program at the University of Kentucky has been active since 1991, and we've done nearly 200 transplants, and in the last 3 years, over 50 transplants. And so it's been able to bring the service to a lot of patients here. And so I think that the program involves a large spectrum of the physicians and the nurses, social workers, dietitians, a lot of folks in the administrative area to be able to help bring transplantation forward here and bring it available close to home.
And you mentioned how many different people are involved in the team. A lot of this begins with patients and their own physicians. How do they go about talking about their options and knowing when they become a candidate for a transplant?
Well, I think timing is crucial when it comes to the availability of transplantation. We have to be able to bring transplantation has a little bit of a lag time in terms of when a patient is listed to the time that they're actually transplanted. So we need to be able to predict ahead of time what their trajectory of their disease is. If they're getting worse fairly quickly, then the systems are in place to be able to help bring them to transplantation sooner. But if a patient comes to us and they're too sick for transplant, then our options are very limited. And so early availability of transplantation by getting the pulmonologist or their primary care physician to have the patient seen allows us to follow the patient along as they go through the process. And when they're ready for transplantation, then Dr. Hayes, myself, and the other physicians that are involved in the process will be poised to be able to move them quickly to transplantation.
Well, thank you all for the work that you do for so many of our Kentuckians, and thank you for sharing that important information with our viewers today. And Dr. Hayes will be back next month talking about asthma, a very important issue in the state as well.
Right.
We'll be right back with a check of the forecast.